Good afternoon, everyone. It's great to be with you today to talk about the work that we're doing in contact tracing. I'll be focusing on the work that we're doing with two state health departments in Maryland and Delaware, and talk a bit about how we're helping the city of Chicago with its contact tracing efforts. As you're hearing from Jen and Michael's presentations, NORC's 80-year history is rooted in survey research and other types of research and evaluation. In March and April of 2020, we were all reeling from the prospects of for our country's well-being and didn't know how the pandemic would affect our clients and our research work. But we were ready to do whatever we could to bring our skill set to bear on helping this growing COVID-19 that was just overtaking the country. Then in April of that year, we were approached about bidding on a telephone-based contact tracing work for the Maryland Department of Health. We had never undertaken a public health service like this, and really no one had ever done contact tracing on this scale. But we realized that our survey research experience and the handling of sensitive health information put us in a very strong place to help with the contact tracing work. So as you see from the timeline, within 8 weeks, teams across NORC came together to seamlessly launch not one, but two instances of this brand new service offering. Our teams were successful not only in getting operations up and functioning in record time, but also in getting people to actually answer their phones and complete contact tracing interviews. And a rapid response clearly was required for this unprecedented situation to meet this public need. And as you'll see from the timeline when you can get the slides, from the point we heard about the potential need to the time we started working was less than 2 weeks in each of Maryland and Delaware. And within 8 weeks, we were fully functioning and dialing for the contact tracing work. That 8 weeks included working with states and an external IT vendor to set up the data management systems and the call scripts, and then developing a fully remote training program and hiring and training almost 600 contact tracers within the two states. This kind of responsiveness, I think, was only possible because of that extensive experience we brought setting up large-scale data collection operations and handling that sensitive health data for federal and state clients. So let me just give you a brief overview of what contact tracing entails so that you can have a better sense of how we're applying these adapted data collection skills. Once someone tests positive, their laboratory confirmed data get forwarded to the Health Information Exchange that's a part of required laboratory reporting. People who are positive for COVID get called and informed about how to protect themselves and those around them, given guidance for isolation during their infectious period, and asked for the names of people with whom they've had close contact and may have exposed to COVID. We then call the contacts to let them know that they may have been exposed and that they're expected to quarantine to protect their community from further spread. In both cases, people are contacted as in follow-up for up to 14 days by SMS, email, or phone to check on their symptoms and see if they need any resources to help them through their isolation or quarantine. In fact, in Chicago, we are establishing a resource coordination hub to support people who are affected by COVID, something akin to a 211 system, a one-stop shop to help link people with needs to a variety of community-based services. So what is it actually that we're doing? The success of this and operational success depended on a successful collaboration among multiple research departments, our survey field operations team, our IT team, and our telephone survey operations team. We're working on a platform that uses Salesforce as the case management system, and it's integrated with Amazon Web Services telephony. Our IT project managers have done an amazing job bridging another vendor's product that was being operationalized and implemented by the NORC deployment team. And one of the things we've realized is that this role has been critical in helping the health departments maintain a robust system that works in practice and for a variety of users, not just the NORC contact tracers, but folks in local health departments, as well as state epidemiologists who are all working on this related efforts. Most of our workforce has been fully remote using their own computers for connection to the system. And we have been doing recruitment, training, and development and quality control all done remotely. We've had great success with the remote training, and it's already being incorporated into other survey projects we're doing. We're running 7 shifts a day, 7 days per week, including all the mini holidays over the last 16 months or so. We've done a lot of tweaking of the schedules over the past year to better respond to when people are most likely to pick up the phone. Because our contact tracers are primarily from the states that they're working for, they know the local area, the community context, and a big part of our success is due to their commitment and their embeddedness within their communities. So if we can go to the next slide with some metrics, I'd like to just talk about how large this operation has been. These give you a sense of the scale and of the first 15 months or so, and the operation is ongoing and probably will be, I'm guessing, through spring of next year. We've been in a near constant recruiting, training, deployment cycle throughout the pandemic, and we've had a great response from Marylanders and Delawareans who want to participate and help out within their state. We've also had great response from our recruiting and training teams who have been in this constant cycle of revising trainings because of systems changes, bringing on new cohorts. They've been dealing with the staffing implications of the multiple surges and declines we've seen throughout the pandemic, all of which are exacerbated by the burnout that callers can experience in working with COVID. Given the high volume of cases we've had at various times, we introduced inbound calling to optimize the likelihood that a respondent would find time that met their needs so that we could get a completed interview and begin the process of working with them. We also initiated introductory text messages to both legitimize the phone number that people see so they will pick up their phones. It also increases the likelihood that they will call into the inbound line and increase the number of responses that we get. So finally, what have we learned from this pivot? There are a few things I think that made it successful, and we're taking the lessons from contact tracing back to our research work. First of all, we found that technologies that have been developed for other fields can be applied to both public health surveillance and research. Salesforce has great potential as a case management tool, and we've begun employing it in some of our research projects already. Amazon Web Services, AWS, has performed well as the telephony infrastructure for contact tracers working from their own computers and internet connections, and it can be used as a tool to facilitate distributed contact centers with applications for other data collection projects requiring a soft phone solution. We and our clients have benefited greatly, as I said, from our IT team who have served as effective consultants and problem solvers for the clients as well as for other vendors. They've really been the glue that has helped hold together the systems and operational sides of the house. We were effectively refining a system that we were implementing and being held responsible for, but not developing. And that's always a tough place to be. And they've really helped out greatly with that. In dealing with this high volume of sensitive data, we brought to bear consultation on telephone data collection best practices and questionnaire scripting. We've helped integrate multiple data collection modes. And we have helped with large-scale call center system design to make the contact tracing process efficient and ensure that the solutions met the needs of all these various stakeholders and end users. In terms of supporting this large data collection cohort, we found that remote and asynchronous training is as effective as in-person training has been for us historically. Our field management team applied their expertise as well in managing these remote workforces and forecasting interviewer and supervisor needs in this ever-changing pandemic. And while we've had interviewers working remotely in the past, what was new here was that they were all working from home and that introduced new challenges, and we've learned a lot from that experience. The field management team helped us weather these surges with incentive programs to get extra shifts and calling hours, as well as finding ways to keep interviewers engaged during the slower periods. So in closing, I would just say that the hundreds of NORC colleagues that have been working on this project have put in incredible effort and hours to make all this work. I think I speak for all of us in saying that it's very satisfying to have had such an instrumental role in helping to address the pandemic. We've seen that we can successfully translate a variety of research-derived skills to a public health service offering, and we're ready to do this again as the need arises. And finally, this effort really encapsulated the collaboration that I think characterizes all of our work. This is an enterprise-wide effort that required all of us to bring our best, and I think it's yielded great outcomes for our clients.